When you clench down there, are you actually accomplishing anything? Are Kegels worth it? Hi, I'm your local OBGYN. I love women, and let's talk about it. So we've all been told that the answer to anything with our pelvic health is do a Kegels, and that's sort of like pelvic floor muscle training down below. Now, there are some amazing pelvic floor therapists. Kegels do have a valuable role for certain situations. They actually did studies that show that women who do Kegels or pelvic floor muscle therapy after having a baby have a lower incidence of urinary incontinence and pelvic floor prolapse. In addition, they actually did a study that women who do these types of trainings prior to doing hardcore lifting, weight training, things that increase your tummy pressure, can actually also reduce the risk of urinary incontinence and pelvic floor therapy. Kegels done with a professional, like a pelvic floor therapist, actually are even more productive in helping those areas. Not all people should be doing Kegels, and people that have a lot of tone or something called vaginismus or difficulty with penetration where all the muscles are tense, if you do these types of muscle activities, you could actually increase the tone down there, which would actually be worse for somebody who has those predicaments. So they are functional, they do work. What I tell my patients specifically to do is imagine that somebody gave you a ping pong ball and you're trying to hold on to it with your muscles down there 10 seconds at a time, 3 times in a row. Do that 3 times a day, no more, because you don't want to get hypertoned down there, which would be the opposite of a benefit.